Question 1. A nurse is caring for a patient with COPD. Which finding would be most concerning? A. Barrel chest. B. Use of accessory muscles to breathe. C. A respiratory rate of 26 breaths per minute. D. A productive cough with clear sputum. Answer: C. A respiratory rate of 26 breaths per minute. Rationale: while all these findings are common in COPD, a respiratory rate of 26 breaths per minute is concerning as it indicates respiratory distress or hypoxemia. Patients with COPD often have a chronic productive cough and may develop a barrel chest and use accessory muscles due to long-term effects of the disease. Question 2. Which statement by a COPD patient indicates a need for further education? A. I should use my bronchodilator before my corticosteroid inhaler. B. I need to avoid crowded places to prevent infections. C. Drinking plenty of fluids will help keep my mucus thin. D. I can take over-the-counter cough suppressants if I need to. Answer: D. I can take over-the-counter cough suppressants if I need to. Rationale: COPD patients need to expectorate mucus to clear airways. Using cough suppressants could lead to mucus retention and worsen lung function. The other statements show good understanding of COPD management. Question 3. A nurse is developing a care plan for a COPD patient. Which goal is the highest priority? A. Enhancing nutritional intake. B. Maintaining a patent airway. C. Increasing physical endurance. D. Managing anxiety levels. Answer: B. Maintaining a patent airway. Rationale: the primary focus in COPD care is to maintain a patent airway and adequate oxygenation, as respiratory issues are the most life-threatening. Other goals are also important but secondary to respiratory function. Question 4. A nurse is assessing a COPD patient and notes a new onset of cyanosis. What is the nurse's immediate action? A. Administer bronchodilators. B. Increase the flow rate of oxygen. C. Assess oxygen saturation and respiratory rate. D. Encourage the patient to cough and deep breathe. Answer: C. Assess oxygen saturation and respiratory rate. Rationale: the nurse should first assess oxygen saturation and respiratory rate to determine the severity of hypoxia and respiratory distress. This information guides further interventions such as adjusting oxygen therapy or administering medications. Question 5. Which of the following is a risk factor for COPD? A. High altitude living. B. Long-term aspirin use. C. Occupational dust exposure. D. Excessive alcohol consumption. Answer: C. Occupational dust exposure. Rationale: exposure to dust, chemicals, and pollutants, especially in occupational settings, is a known risk factor for COPD. Smoking is the primary risk factor, but environmental and occupational exposures also contribute significantly. Question 6. A patient with COPD is prescribed a short-acting beta-2 agonist. What is the primary purpose of this medication? A. Suppress inflammation in the airways. B. Reduce the production of mucus. C. Dilate the airways to improve breathing. D. Treat bacterial infections in the lungs. Answer: C. Dilate the airways to improve breathing. Rationale: short-acting beta-2 agonists are bronchodilators that quickly relax the muscles around the airways, leading to dilation and easier breathing. They are commonly used for quick relief of acute symptoms in COPD. Question 7. Which dietary recommendation is most appropriate for a patient with COPD? A. High carbohydrate, low protein diet. B. High fat, low carbohydrate diet. C. High protein, low carbohydrate diet. D. Low fat, high fiber diet. Answer: C. High protein, low carbohydrate diet. Rationale: A high-protein, low-carbohydrate diet is recommended for COPD patients to maintain muscle strength and reduce carbon dioxide production associated with carbohydrate metabolism. Proper nutrition is essential for maintaining overall health and managing COPD symptoms. Question 8. A COPD patient is experiencing cor pulmonale. Which assessment finding supports this condition? A. Peripheral edema. B. Dry, non-productive cough. C. Increased respiratory rate. D. Barrel chest. Answer: A. Peripheral edema. Rationale: cor pulmonale, or right-sided heart failure due to lung disease, often presents with peripheral edema, especially in the lower extremities. It's caused by increased pressure in the pulmonary arteries, leading to right ventricular hypertrophy and failure. Question 9. Which intervention is most effective in promoting airway clearance in a COPD patient? A. Administering high-flow oxygen. B. Encouraging pursed lip breathing. C. Prescribing frequent rest periods. D. Increasing fluid intake to 3 liters per day. Answer: B. Encouraging pursed lip breathing. Rationale: pursed lip breathing helps slow down exhalation, preventing airway collapse and allowing better airway clearance. It's a simple and effective technique to improve breathing in COPD patients. Question 10. A nurse is teaching a COPD patient about smoking cessation. What is the primary reason for this intervention? A. To reduce the risk of lung cancer. B. To improve the effectiveness of COPD medications. C. To decrease the progression of COPD. D. To increase the patient's life expectancy. Answer: C. To decrease the progression of COPD. Rationale: smoking cessation is crucial in COPD management as it is the most effective way to slow down the progression of the disease. While it also reduces the risk of lung cancer and increases life expectancy, the immediate goal in COPD management is to halt disease progression. Question 11. When educating a COPD patient about the use of a metered dose inhaler, MDI, what is an important point to emphasize? A. Use the MDI immediately after a nebulizer treatment. B. Inhale quickly and sharply when using the MDI. C. Wait 1 minute between puffs if taking multiple doses. D. Shake the inhaler for at least 30 seconds before use. Answer: C. Wait 1 minute between puffs if taking multiple doses. Rationale: it's important to wait about 1 minute between puffs when using an MDI with multiple doses. This allows the first dose to settle and the second dose to be more effective. Shaking the inhaler is also important, but usually for about 5 to 10 seconds, not 30. Question 12. A COPD patient has a chronic productive cough. Which type of medication should be avoided in this patient? A. Expectorants. B. Bronchodilators. C. Cough suppressants. D. Antibiotics. Answer: C. Cough suppressants. Rationale: cough suppressants should be avoided in patients with a chronic productive cough, as they can inhibit the cough reflex necessary to clear mucus from the airways. The other medications may be appropriate depending on the patient's specific condition and symptoms. Question 13. What is a common complication of advanced COPD? A. Asthma. B. Pneumothorax. C. Bronchiectasis. D. Pulmonary fibrosis. Answer: B. Pneumothorax. Rationale: pneumothorax, or collapsed lung, is a common complication in advanced COPD due to the destruction of lung tissue and formation of bulli, large air spaces. The other conditions listed are separate pulmonary disorders. Question 14. Which finding in a COPD patient may indicate the need for long-term oxygen therapy? A. Oxygen saturation of 92% on room air. B. Frequent episodes of bronchitis. C. PaO2 less than 55 mm of mercury or SaO2 less than 88%. D. Use of accessory muscles during normal activities. Answer C. PaO2 less than 55 mm of mercury or SaO2 less than 88%. Rationale: long-term oxygen therapy is typically indicated for COPD patients with a PaO2 less than 55 mm of mercury or an SaO2 less than 88%. This level of hypoxemia suggests that supplemental oxygen is necessary to maintain adequate tissue oxygenation. Question 15. A COPD patient reports increased shortness of breath. Which action should the nurse take first? A. Administer a rescue inhaler. B. Increase the oxygen flow rate. C. Assess the patient's lung sounds. D. Elevate the head of the bed. Answer C. Assess the patient's lung sounds. Rationale: the first step should be to assess the patient's lung sounds to determine the cause of the increased dyspnea. This assessment guides appropriate interventions, which may include administering a rescue inhaler or adjusting oxygen therapy. Question 16. Which statement by a patient with COPD indicates an understanding of their oxygen therapy? A. I can adjust the oxygen flow rate based on how I feel. B. I should use my oxygen continuously, even when I feel fine. C. I only need to use oxygen when I'm feeling short of breath. D. Oxygen therapy will cure my COPD. Answer B. I should use my oxygen continuously, even when I feel fine. Rationale: continuous use of prescribed oxygen therapy, even when asymptomatic, is crucial for maintaining adequate oxygen levels. Adjusting the flow rate without medical advice or using oxygen only when symptomatic can be harmful. Oxygen therapy does not cure COPD but helps manage symptoms and prevent complications. Question 17. A nurse is planning care for a COPD patient with 3+ pitting edema in the lower extremities. Which intervention should be included? A. Encourage ambulation every 2 hours. B. Apply tight compression stockings. C. Restrict fluid intake to 1 liter per day. D. Elevate the legs when sitting. Answer D. Elevate the legs when sitting. Rationale: elevating the legs can help reduce edema by aiding venous return. Ambulation is also beneficial, but care must be taken not to overexert the patient. Compression stockings can be used, but they must be properly fitted and not too tight. Fluid restriction should be based on overall fluid status and medical advice. Question 18. Which symptom in a patient with COPD requires immediate medical attention? A. Chronic cough. B. Gradual increase in dyspnea over several months. C. Sudden onset of confusion and lethargy. D. Increased sputum production. Answer C. Sudden onset of confusion and lethargy. Rationale: sudden onset of confusion and lethargy can indicate acute hypercapnia, elevated CO2 levels, or hypoxemia, requiring immediate evaluation and intervention. The other symptoms are typical of COPD but are not usually emergencies. Question 19. A patient with COPD is prescribed tiotropium. What is the primary action of this medication? A. Reduce inflammation in the airways. B. Thin the mucus in the airways. C. Dilate the airways. D. Suppress the cough reflex. Answer C. Dilate the airways. Rationale: tiotropium is a long-acting bronchodilator that relaxes the muscles in the airways and widens the airways, making breathing easier. It's not primarily used to reduce inflammation, thin mucus, or suppress cough. Question 20. What is the primary goal of pulmonary rehabilitation in a patient with COPD? A. Cure the lung disease. B. Increase lung capacity. C. Improve quality of life. D. Eliminate the need for medications. Answer C. Improve quality of life. Rationale: pulmonary rehabilitation focuses on improving the overall quality of life for patients with COPD. This includes increasing exercise tolerance, managing symptoms, improving functional capabilities, and providing education. It does not cure the disease, significantly increase lung capacity, or eliminate the need for medications. Question 21. A COPD patient is experiencing acute shortness of breath. Which nursing action is appropriate? A. Instruct the patient to breathe into a paper bag. B. Encourage deep breathing and relaxation techniques. C. Administer sedatives to reduce anxiety. D. Position the patient in high Fowler's position. Answer: D. Position the patient in high Fowler's position. Rationale: placing the patient in high Fowler's position, sitting upright, can facilitate easier breathing by reducing pressure on the diaphragm. Deep breathing and relaxation can also be helpful, but breathing into a paper bag or administering sedatives without addressing the cause of the shortness of breath could be harmful. Question 22. In assessing a patient with advanced COPD, the nurse notes clubbing of the fingers. This finding is associated with A. Chronic hypoxemia. B. Poor nutritional status. C. Inadequate use of inhalers. D. Frequent pulmonary infections. Answer: A. Chronic hypoxemia. Rationale: clubbing of the fingers, characterized by bulbous enlargement of the ends of the fingers, is associated with chronic hypoxemia. It's a sign of long-term oxygen deprivation and is not directly related to nutritional status, inhaler use, or frequency of infections. Question 23. When teaching a COPD patient about energy conservation, which strategy is most effective? A. Limiting all physical activity. B. Performing all activities in the morning. C. Using a rolling walker for mobility. D. Planning frequent rest periods during activities. Answer: D. Planning frequent rest periods during activities. Rationale: energy conservation for COPD patients includes planning regular rest periods to prevent fatigue and preserve energy. It's important to balance activity with rest, rather than limiting all physical activity, which can lead to deconditioning. Question 24. Which symptom in a COPD patient would indicate the development of a secondary infection? A. Persistent cough. B. Change in sputum color or consistency. C. Shortness of breath after exertion. D. Wheezing during exhalation. Answer: B. Change in sputum color or consistency. Rationale: a change in sputum color, consistency, or amount can indicate a secondary bacterial infection. While cough, shortness of breath, and wheezing are common in COPD, changes in sputum characteristics are more specific for infections. Question 25. A patient with COPD is scheduled for a spirometry test. What is the purpose of this test? A. To measure the patient's oxygen saturation. B. To determine the severity of lung obstruction. C. To identify the presence of lung infections. D. To evaluate the effectiveness of inhaled steroids. Answer: B. To determine the severity of lung obstruction. Rationale: spirometry is used to measure the volume and flow of air during inhalation and exhalation. It's a key diagnostic tool in COPD to determine the extent of lung obstruction and monitor disease progression. It does not measure oxygen saturation, detect infections, or specifically evaluate the effectiveness of inhaled steroids. Visit nursestudy.net for more nursing practice exams, care plans, and study guides.